Hello friends! Welcome to my new YouTube channel, Guardian Home Care, with the new video about bandaging dangers and instructions for elders. Let's start video now. Do you know that improper bandaging can be dangerous, especially for older adults? Many people think bandaging is a simple act of wrapping a wound or securing a limb. But for seniors, it can mean the difference between healing and harm. Elderly skin is thin, fragile, and heals more slowly than younger skin. A tight or poorly placed bandage may cut off circulation, cause swelling, or even trigger severe complications like tissue damage. In fact, for individuals with heart failure, diabetes, or poor circulation, a wrong bandage could potentially be life-threatening. This is why bandaging must always be done with caution, awareness, and the right technique. In this video, we'll guide you through the dangers of bandaging for elders, when and how to use them safely, and key instructions every caregiver should follow. By the end, you'll feel confident in protecting your loved one with care instead of putting them at risk. 1. Understanding elderly skin and circulation risks. Older adults face unique health challenges. Their skin is thinner, more fragile, and prone to bruising or tearing with even slight pressure. Circulation problems are also common among seniors, especially those with diabetes, heart failure, or peripheral artery disease. A tight bandage can stop blood flow, creating numbness, tingling, or even tissue death. On the other hand, a bandage that is too loose won't provide proper support or protection, leaving the wound open to infection. Knowing these risks helps caregivers take precautions. It's important to remember that while bandages protect wounds, they must be applied with both gentleness and precision. Checking circulation regularly, such as looking for changes in skin color, swelling, or coolness of the limb, is a life-saving habit every caregiver should develop. 2. When should you bandage? Not every cut, scrape, or bruise needs a bandage. Caregivers must know when to apply one. For elders, bandages are generally needed when there is an open wound, bleeding that must be controlled, or to protect fragile skin from friction and infection. However, small, superficial scrapes can often heal better when exposed to clean air. Over-bandaging can trap moisture, leading to skin breakdown or fungal growth. If your loved one has fragile or thin skin, sometimes a protective dressing without tight wrapping is safer. Also, never bandage a wound that shows signs of severe infection like pus, spreading redness, or fever without medical advice. In those cases, immediate professional care is required. Understanding when not to bandage is just as important as knowing how to do it correctly. 3. Types of bandages and their uses. There are many kinds of bandages and each has a purpose. Adhesive bandages are good for small cuts, while gauze pads with medical tape protect larger wounds. Elastic bandages can provide support for sprains, but may restrict circulation if too tight. Hydrocolloid or foam dressings help fragile skin by keeping wounds moist for healing. For seniors, soft and non-adhesive options are often best to avoid skin tears when removing them. Caregivers should keep a basic supply kit with sterile gauze, adhesive-free wraps, medical tape, and scissors. Remember, choosing the right bandage reduces complications and makes recovery faster. 4. Step-by-step bandaging for elders, wounds. When bandaging an elderly wound, follow these steps. First, wash your hands thoroughly. Clean the wound gently with mild soap and water or saline solution. Pat it dry with a sterile cloth. Place a sterile dressing directly over the wound to prevent infection. Then, wrap the bandage carefully, ensuring it covers the dressing but isn't tight. Check circulation. Fingers or toes beyond the bandage should stay warm and pink, not cold or blue. Secure with medical tape that won't pull on fragile skin. Always recheck after 10 minutes to ensure comfort and circulation. 5. Common mistakes to avoid. Caregivers often make mistakes when bandaging elders. The most common include wrapping too tightly, leaving bandages on too long, using adhesive directly on fragile skin, or forgetting to check circulation. Another mistake is reusing bandages, which increases infection risk. Some caregivers also fail to replace bandages daily or when soiled. Remember, cleanliness, proper fit, and daily monitoring are essential. Ignoring these can turn a small wound into a major health crisis. 6. Warning signs of trouble. After bandaging, caregivers must watch for warning signs. If the area becomes swollen, blue, or cold, remove the bandage immediately. If your loved one complains of numbness, tingling, or severe pain, circulation may be cut off. Also, watch for signs of infection, pus, redness, spreading warmth, or fever. If any of these occur, seek medical help right away. For elders with heart conditions, even mild swelling in the legs could signal worsening heart failure, not just a bandaging issue. Never ignore these red flags. 7. Special considerations: heart failure and diabetes. Elderly individuals with heart failure and diabetes need extra care with bandaging. In heart failure, fluid retention causes swelling in legs and feet. Wrapping too tightly can worsen this and impair circulation. For diabetics, even a small wound can become dangerous if ignored. Poor sensation in their feet means they may not notice a tight bandage until severe damage is done. For both conditions, always check circulation frequently. Use soft dressings and avoid elastic bandages unless prescribed. When in doubt, consult a healthcare professional before applying compression or firm wraps. 8. Conclusion and caregiver encouragement. Caring for an elder is an act of love, but it also comes with responsibility. Bandaging may seem simple, but for older adults, it carries hidden dangers. By knowing when to use bandages, how to apply them safely, and what warning signs to watch for, you protect your loved one's health. Remember, gentle, careful, and attentive bandaging prevents harm and promotes healing. When in doubt, never hesitate to seek professional advice. You are not just covering a wound, you are safeguarding someone's comfort, dignity, and life. Please subscribe our YouTube channel to get more videos. See you soon with the next video. Bye!